what we have planned for today is quick welcome from my side, and then we'll go into the exciting stuff. The Danish Precision Health Initiative, the Delphi study, which just recently launched at the University of Copenhagen, one of the world's largest studies with wearables, with consumer wearables over a very long period of time. So very excited to hear from Jordi on that a little bit. And then we'll dive a little bit deeper, not only on the scientific side, but also on the technology side and what really powers that behind, or what really is behind such a study in terms of the study management and in terms of all the data integrations. And this is where we have Thomas, who will be talking about Unikk, one of our platform partners.
Thanks for the invitation to present on the Delphi study. I prepared a few slides. I like to share them with you. I'll talk a little bit more what is this study about, the rationality, the design, and the challenges that we face when designing a study like that. And we call it Danish Precision Health Initiative, and it stands for Delphi. What I want to argue is that these studies include a breadth of data, but they miss critical aspects that are very relevant on how people transition from a healthy to a disease stage. For example, the UK Biobank has limited, and the All of Us program have limited granular socio-behavioral data. Where you live, what is your income, your education, your behavior, the smoking, diet, those things are not pretty well captured in these other repositories. These two repositories also miss aspects of the day-to-day routines. For example, how hungry you are at a certain point, your mood, whether you have good social connections and social relationships. These studies are also very static. They are cross-sectional. They only capture a one-time assessment measurements. We believe that dynamic perturbations are very relevant. For example, consuming certain amount of foods, consuming certain meal tests, and then doing some sort of exploration among these tests. Performing physical activity can help us to identify biological markers that are not traditionally captured in these other studies. One of the things that we feel that it's needed to advance precision medicine is precision measurements. Sometimes these studies, they prefer to have a higher number of individuals and they care less about the determinations and the measurements. We think that there is a lot of value on accurate and precise measurements, because then all the things that we infer from this data will have a much more impactful meaning. And then most of the studies also miss the lifelong view from the healthy to a disease stage, from birth to death. And this is possible only in places in which you have a strong healthcare national registers that allow you to understand all the clinical events that a person has during the life course. So with this, we decided to launch the Danish Precision Health Initiative, or Delphi. So in the Delphi study, participants come to the hospital after an overnight fast. They go through a specific anthropometric measurements, a DEXA, body composition, a blood test, and then we spend 1 hour with them, putting them some wearables and giving them instructions for all the things that they will need to do for the next 2 weeks. And a central element of this session is the mobile phone application that we have specifically designed for the study. This mobile phone application, it's like a notebook on everything that they have to do. They have a timeline, they have all the tasks, we can send reminders, we can communicate with the participants. So this is a very central element in our study. And this initial contact with the participants takes 3 hours. After this, they are left home for 10 days, and they have to do a lot of active tasks. Some of the data that we capture, it's passive. The participant doesn't need to do anything, just to wear the devices that we put on them, but others require some sort of interaction for the participant. Among the passive monitor things that we're doing in our study, it's to put them a 24 hours blood pressure monitor, a continuous glucose monitor, a silicone band that captures pollution, a Garmin badge, and a physical activity tracker. Then they are instructed to complete specific tasks. One is a cognition game that they have to play, and then we can assess different cognition domains. We ask them to do dynamic tests. So we provide them 2 meals. One is an oral glucose tolerance test. The other one is a meal mix tolerance test. And we ask participants to take blood themselves while they are consuming these meals. not just only when they are consuming these meals, but after 30 minutes later, 2 hours later, 4 hours later, with a device that enables the remote collection of blood. We ask them to collect biospecimens, urine, stool. They have to record everything that they eat, and they have to fill specific questionnaires. And everything is integrated in this mobile phone application that I just mentioned. After these 10 days, they are invited again to the hospital, and then is where we do the deep clinical measurement profiling. As you can see here, there are 16 procedures. Participants go one after another, and we can measure many things related to their cardiovascular health, liver health, adipose tissue, dynamic testing like muscle strength, cardiorespiratory fitness, and many other things. The idea is not just do this at once. So what I just explained it would be like the baseline assessment. And our plan is to follow the participant for the next 25 years to come. And then we will have these repeated assessments every 2 or 4 years, depending on the participants. And then we will follow the participants through online surveys. So some technological developments, and this is my last slide. We see Delphi, when we started with Delphi, this was like an iceberg for us. The most easiest thing was to pick the phenotypes that we wanted to assess. We wanted to assess blood pressure, we wanted to assess liver fat, but then it becomes clear that the technological challenges that we needed for this study were massive. We were able to overcome some of these challenges and come with a creative solutions thanks to the collaboration with Unikk. I mentioned the mobile phone application. It's a central element on our study, and what it keeps the participants know what they have to do and what allows the communication with the participants. We had to invent different data flows for all the wearables and all the devices that people use. We had to design a web page that enables the recruitment and the public dissemination of the study. We have a solution for invitation to participate in the study through a very particular system in Denmark that it's the digital post, in which you only get relevant information in this post. We develop a lot of clinical data capture app solutions to make sure that there were not errors with the reporting and of the data collection. So everything goes to our internal database in a pretty automatic way, in which minimal or little input from the test leaders. So in Denmark, we have a strong legal and ethical regulation through GDPR. All our solutions and technical capabilities needed to be GDPR compliant. And then we had this view that the study will not only happen at the University of Copenhagen, and we will need to expand and scale. So all the elements that we develop has this scalability in mind. And the most important, this is a almost autonomous data capture, fully digital study, and it's designed with the participant in mind. We are aware that people are follow on their daily routines, and what we wanted to do from the very beginning is to facilitate things, to make sure that the participants can be compliant and can be comfortable with the study, and this is the as less invasive as we can. And with this, I'll pass it to Thomas, who can explain more about the technological challenges.
So having that in mind, we built and are still expanding the DataMentor platform, the platform that Jordi and his team is using, and which has a number of component parts. Still, when I double click on the platform, it's all about the high quality data sets. It's about the protocol being lean in its implementation, both for the participant, but definitely also for the staff. So eventually, it's also about novel health intervention. The Delphi study is a non-intervention study, but still a lot of our customers are also coming to us to get a platform that extends into that. So let me elaborate on what this entails. As a foundation, we bring technology and operational excellence combined with health competence from nutritional and human physiology professionals. So we're technology, but we also know a bit about health. This we combined with our best practice of IT and legal compliance, while emphasizing the ethical matters too. This matters to both the researchers, but definitely also the participants. Then we create an ever-growing suite of data sources. We heard Jordi mention some of them. It's from smartphones over more advanced devices, or here under Garmin watch and scales. We talked also about the meal logging with AI, the cognitive indexes, and so forth. And in order to cater an easy access, we create a configurable user interfaces. The app is one of them, but there's also web interfaces. For example, food frequency questionnaires is not suited for mobile, but it's more on a web that dashboard suited. The participant management is actually quite crucial also for this style. So finally, I will continue to working with our customers to enable interventions that evidently are their intellectual property while being hosted at DataMentor. The same goes with data. Data that the participant has donated for you to create knowledge from. So DataMentor acts as a bridge between you and the participants. In a simplified term, we have made complex technology accessible as a service by developing a set of building blocks. This is the DataMentor platform in a nutshell, and it constitutes a loop of trust between you and your patients or participants. And obviously, it is brought to you with a set of contemporary UIs. Let's have a sneak peek on that. So configurable user interfaces really is the core here that you can actually go in and you can quickly and lean deploy. So it's both intuitive because we use best standard, but also we are fitted to the context, whether that's through our AMARs or Abacus measures and adaptions, or it's through the common standards of UIs, even used in social media. Furthermore, data both in its capture and its use needs to be both managed and secure. So how is things going on with the participants? What are the trends? How can you log in with your trusted ID? How can you get trusted feedback in the loop of intervention studies? Finally, to reach results based on data, some customers have asked us to a safe harbor for data use. Others does it themselves. But really, this is again listening to our customers and the participants in order to give a comprehensive and suitable set of building blocks that can be deployed quicker and also more cost efficient than most others. So now we heard about me talk about the DataMentor platform. We heard Jordi talk about the Precision Health Initiative, which is a large cohort study for many years. Still, the Danish Precision Health Initiative evolved and was inspired from more explorative, smaller studies. And in order to demonstrate how DataMentor assists those two, I have invited you, Lisette, from the Cyclome Study. Over to you.
Thank you. Thank you for the invitation. I am Lisette and I'm working at the Danish Headache Center at the hospital in Denmark. And we've been focusing a lot on migraine research. Just like many other studies, diseases, there's differences between sexes. So, for example, migraine, depression, osteoporosis, autoimmune disorders, ADHD. Many are more prevalent in women, or symptoms are actually different between the sexes. If we look at migraine as an example, we see that there are 3 women for each man having migraine, but we also did a big study seeing that the symptoms of migraine are pretty much different for women compared to men. So there's way more MO, so migraine without aura, while men have more migraine with aura. The attacks are different. So there's, for example, the attacks are longer, more frequent. They're often coming by physical activity, and so on and so on. Then there's a subtype of migraine called menstrual migraine. So this, of course, only happens in women. And you have pure menstrual migraine, related menstrual migraine. With pure menstrual migraine, the attacks only happen in the small window of menstruation, while menstrual related migraine can also happen outside, but 2 out of 3 attacks needs to be inside the menstruation. So we are pretty sure that hormones have something to do with migraine and with many other diseases, but we don't know what. We know a few of the hormones that are really driving the menstrual cycle, but we also know that many more are indirectly involved. So it's a very complex system of hormonal fluctuations. And we know that it doesn't only affect the menstruation and some diseases, but also immune function, pain sensitivity, metabolism, mood, and so on. We don't know how. Most studies just split the menstruation cycle up in different phases and compare one phase with the other. Well, we know there's way more, it's a continuous phenotype. There's happening something all the time in different directions. So we decided to zoom into that. So do a real like precision health study, but really focusing only on the menstrual cycle. For that, we designed the Cyclome. We invited women to participate and to come into us every single day during one full menstrual cycle. For every day, we would collect a blood sample, a urine sample. We would take a rectal, vaginal, and nasal swabs. They would fill in every day an e-diary with all different questions. And they would wear the Garmin watch to follow them. And then we collected menstrual blood at the first day of menstruation. So a very, very labor-intensive project, as they had to come in every day. And this whole project would lead to a massive load of data. Unfortunately, we have just finished the collection of data, and now everything is in the labs to be analyzed. So I cannot present you any interesting results yet, though I'm pretty sure they will follow soon. But this will be a little bit what we will have to deal with. A multi-omics study with all analyses done, RNA sequencing, proteomics, microbiomics, full hormonal profiling, and then all the phenotype data that we've collected with e-diaries and the Garmin watch. And just to highlight how Unikk has come into this project is in 2 different ways. First of all, of course, with the Garmin watches, they have taken care of that we are getting the data, that the transfer from the watches to our computers was going smoothly. And secondly, with the participant recruitment, we need consent of all the participants, where we could use the digital platform to get their digital signatures.